the initial study, the phase 1-2 study, enrolled a total of 66 patients, the early part of which included dose escalation of the Ixazomib in combination with standard doses of lenalidomide and dexamethasone. The study results were originally published almost 2 years ago, and that had a median follow-up of 14 months, and it showed the regimen to be quite effective and also well tolerated. The current analysis actually focuses on the long-term outcomes with a median follow-up of 55 months amongst 42 patients out of the 66 who actually did not go to a stem cell transplant but continued on therapy with Ixazomib. Now, out of the 42, there were 25 patients who got Ixazomib maintenance as a single agent after the 12 months of induction therapy. So overall, what we found was that amongst these 42 patients, the response rate was about 80%, including about 63% of the patients with a very good partial response or better. The toxicity was very well managed. In the long term, the maintenance portion, there were hardly any new toxicities that we encountered. Most of it was hematologic, primarily anemia and thrombocytopenia. There were no cumulative hematological toxicity with long-term Ixazomib maintenance, but there was a deepening of response with about 8 out of the 25 patients having a deeper response, going from a very good partial response to a complete response. So overall, the triplet regimen appears to be quite effective initial therapy for patients with newly diagnosed myeloma, offers the ability to use a completely oral therapy, and also appears to be quite effective with manageable toxicity, and most importantly, the patients can be continued on maintenance therapy with Ixazomib long term without any additional toxicity, but at the same time improving the efficacy.